All right, so again, my name is Austin. This is for my capstone project in care and prevention of athletic injury. This will be the final project. Over the past few weeks, we've been talking about one specific sport for our youth team here. We identified common injuries to the sport. We talked about how to prevent those injuries, and we talked about some rehabilitation and some exercises to fix those injuries and prevent them in the future. So, final project here. This is simulating me being in a recreation center with some parents and trying to just convince them that, hey, this is a safe sport to play and just give them some information about the sport. But without going further, let's get going. So the sport I chose, male or female, age 8 to 16-year-old swim team. The environment's going to be at Temescal Canyon High School, swimming pool deck. The water temperature will be 82 to 84 degrees. It's also going to occur during the summer months. So, of course, SoCal, summer months, temperatures could be well over 100 degrees. So we'll talk about that later. That's going to be a significant factor um, in this certain sport. So a little description I wrote. Participants will be placed in a friendly and challenging environment that will prepare them for competition and swimming. Participants can develop lasting friendships, mental toughness, and an athletic foundation that will set them up for success in future endeavors. So, just like any other youth sport, has benefits both physically and mentally for them. Is it safe? So, as parents, I think this should be our number one question when we're talking about playing a sport, especially in their youth. We want them to be safe. We want them to live a long and healthy athletic career here. So, with the swimming here, I do want to say it's one of the safest sports that a young athlete can play. One study showed that we got here, one of the safest among high school sports. Of course, only a little bit of our participants for my specific program will be in high school, but just goes to show that this is a very, very safe sport. Another little article here, study rather, shows that 17 injuries per 1,000 times they swam. So essentially this means boys would be at a risk for just one injury out of nearly 6,000 practices and meets. Girls had a rate of 38 per 1,000, which is equal to one injury out of 3,000 times swimming. So very low occurrence of injury within the sport. And of course, non-contact, low impact. So a lot of the injuries we see amongst young athletes come from, contact sports, whether it be football to the, cervical spine, concussion, what have you. And then, the high impact sports tend to leave, athletes with knee joint issues as they age. One thing I do want to bring up, this is what's considered an overhead sport, and there are some injuries that go along with that, but they're very long time, and anyways, we'll talk about those later. Moving on here to our first common injury in swimming, it's going to be hyperthermia. I put this term, it's kind of an umbrella term for several different heat-related injuries, but the definition is elevated body temperature above 98.6 degrees Fahrenheit due to absorbing more heat than the body can dissipate. Risk factors are going to be excessive physical activity and high temperature. So like I said, SoCal, very, very high temperature. And of course, this program does include some out of the water training. So this is going to put some of our athletes at risk here. Another risk factor, poor hydration, electrolyte balance. So something we'll talk about in a bit. Prevalent in overweight individuals, and it's prevalent in the youth as well. So studies have showed that youth have a less developed ability to regulate their body temperature. So that is something we need to take in consideration while they participate in this sport. So, like I said, umbrella term right here, it includes heat rash, heat syncope, which is loss of consciousness from the heat-related injury, heat cramps, and heat strokes. So, heat cramps, direct correlation to our hydration, electrolyte balance, and heat stroke, very serious life-threatening injury coming from the body overusing, trying to dissipate that heat. Mechanism of injury, here's some very, very specific ones, but generally, mechanism of injury is going to be an athlete, of course, participating in excessive exercise in a very, very hot and humid environment. Down to the bottom right there, we see the heat index chart. That's something that can be used from coaches like myself for this athletic program. And of course, if they're in that red range, it's going to mean that they are at extreme danger. The orange puts them at high likelihood. Yellow, still high likelihood, and light yellow is going to be even less. So, mechanism of injury, we do want to talk about that excessive working out. Someone who just recovered from a flu, so if they had, vomiting, diarrhea, they're going to have very low fluid in their body, so that'll put them at risk as well. High caffeine, poor hydration, all those are going to put the athlete at risk here. So if we want to prevent this from happening, make sure you're hydrated prior to exercising, and make sure you're kind of adapted to the environment that you'll be in. Assessment, so right here, I do actually work as an EMT, so I'm kind of familiar with these assessments, if that kind of helps, and I don't know, I'm sort of able to identify some of these injuries coming on. So primary here, we do just want to alert or figure out whether our patient's alert and oriented. So if they have, how can I put this? If they're altered or what have you, that's going to be considered very serious, and we're going to have to call for 911 or advanced life support for them. We also want to make sure that their airway is nice and open, and their breathing they're able to maintain their breathing on their own, and they have good circulation in their body. So we can do all these things just simply by using common sense, checking out their pulse on their radial, and monitoring their breathing, make sure that they're getting oxygen into their tissue in their body. So like I said, call 911 if any of those things present. Also, secondary assessment here, we can check their responsiveness, their pupils, level of consciousness, temperature, rate of breathing, quality circulation, and blood pressure. So those are all significant findings we could use regarding this condition. Another thing we could do is figure out their medical history. If they've had this before, if they have any other symptoms, we need to talk about if they have allergies, medications they take, last thing they had to eat, drink, what they did prior to exercise that day. So all these things are important when we're talking about their injury at hand. So disposition here, I wrote, determine whether or not first responders should be called due to severity of illness. If under 18, parent or guardian should be contacted, and patient should be given to a higher level of medical care. So if you're ever unsure, do the safe thing, call 911, get the experts to them to see if they're okay. So anatomy here just talks a little bit about the injury a little bit more. Hyperthermia and other heat illnesses are mostly associated with circulatory system. They're characterized by hypotension, which is low blood pressure, peripheral vasodilation. This could lead to decreased cardiac output, so the oxygenated blood that our hearts pump to our body is decreased. This can be observed in rapid heart rate, high core temperature. So those are all responses our body's trying to make up for this change in temperature. Low blood pressure, we could see that later on if their blood volume's lowering because of their dehydration. Paleness, profuse sweating, and cramps, dizziness, and loss of coordination. So all those things are symptoms that our patient will be presenting with if they have a heat-related injury. Treatment, cold packs, probably some of the best things we could do here. Remove from heat, shade and expose, wet and fan, and move to an air-conditioned environment. So we want to remove them from that very hot source and just let them cool down. The instant cold pack, it's been shown that placing them on the groin into the back of the neck, it says anterior, it should say posterior, are great ways to cool the patient down. And reassess frequently and avoid shivering. Preventative rehabilitation exercises, brought it up a little bit earlier. Basically, summarize all these things is to hydrate, prepare for your exercise, and grow accustomed to the environment. All these things can prevent the injury from happening in the future. So next injury, bicep tendonitis, very common in these overhead sports that I was just talking about. This sport specifically places a tremendous amount of weight-bearing activity on the upper body. And specifically in swimming, a lot of it's from the pulling motion of the upper body. So biceps tendonitis is characterized by painful inflammation of the long head of the bicep from overuse. So here's kind of the bicep tendon. This basically, so much weight is placed on this tendon, this muscle here, that the tendon actually becomes inflamed, and it's basically a inflammatory response to what's going on. So initial stages characterized by redness and swelling. Later stages, bicep tendon often thickens and grows larger. So risk factors, like I said, multiple overhead activities, overtraining, and pulling movement. Mechanisms of injury have very specific ones again, but some mechanisms we'll see are athletes participating in multiple overhead activities. So I think one of these talks about one athlete's trying to participate in rowing, and he's also participating in swimming. So, twice the physical activity they should be having, definitely a risk factor. Also, athletes that participate in heavy weightlifting along with swimming can put them at risk as well. Assessment, so check for pain or tenderness in the front of shoulder, upper arm bone, and occasional snapping or sensation in the shoulder. So those are all indications that bicep tendonitis is happening. You also assess for decreased range of motion and decreased strength and stability in the shoulder and bicep area. These are also symptoms of biceps tendonitis. Anatomy, so here's a little bit better picture. We've got the long head of the bicep here. This is responsible for a great deal of movement when swimming. The origin of this muscle is the supraglenoid tubercle of the scapula. The insertion is the posterior border of the bicipital tuberosity in the radius. With repetitive stress, the tendon of the bicep becomes inflamed, characterized by pain, aching, tenderness, crackling on the anterior aspect of the elbow joint. So, basic review at this point of what we've been talking about, but a little bit more in depth on what exactly is happening in this injury. Treatment, so right here, rest can be one of the best treatments of injury. So like I said, one of the common mechanisms of injury is overuse. Obviously, take away that overuse, give yourself some rest, and let it heal. So ice multiple times daily. I actually attach another video of myself and a partner talking through some of these treatment options for the biceps tendonitis, and stretch and lightly exercise the affected area. So here's a little program. Like I said, I have another video where I go way more into detail on all these exercises and a little training program for you if you were to come across biceps tendonitis. So the final common injury is simply going to be superficial injuries to the foot. Right here I got abrasions, lacerations, avulsions, burns, and first and second degree burns. So abrasion, simply superficial damage to the epidermis of the skin. Laceration, that could be a deep cut or tear in the skin. Avulsion, skin is torn from the body. You can't really see it in any of these pictures, but the skin's actually torn away. Burns, first degree, that's just going to be pain and redness. We can actually see this with a sunburn as well. Second degree burn, this starts to look like a second degree burn. Right here, you can see the blistering here and here. This can affect the epidermis or the dermis. It causes pain, redness, swelling, and blistering. Risk factors, walking barefoot and walking on variable surface. So those are two things we can potentially see on the pool deck. Swimmers sometimes can get too lazy to put on their shoes, and end up walking in the hot ground and could potentially burn their feet. Variable surfaces, ideally, the pool deck's going to be nice and clean, but you never know. Could be some variable things on the deck. Mechanism of injury, again, very specific here, but generally it's going to be a patient stepping on something very sharp, just like this rusty screw here, glass. Of course, that's why they say no glass on the pool deck. And also someone walking on hot asphalt, which can be seen, of course, just about anywhere in the summer months of SoCal. Assessment, so first thing we need to do is make sure this isn't a life-threatening bleed. The chances of it being in this environment are very, very low, but what we're going to do, apply direct pressure create a pressure bandage. They say if bleeding continues, don't think that it's going to be a problem here, but if we got to that point, you could apply a tourniquet as well. But really don't think that's going to be an issue here. Simply just need to control the bleeding, maybe clean the wound, and put a bandage. Not too bad. Anatomy, so here's a little bit of info about the skin. You could check that out. Shows all the the layers of the skin: the epidermis, dermis, hypodermis. Of course, the first degree or superficial cut just going to affect the dermis or epidermis rather. The second degree could be partial thickness and affects the dermis, and third degree goes all the way to the hypodermis. Treatment for these, already talked about a little bit: direct pressure, pressure dressing. If bleeding is controlled, rinse with normal saline. So a lot of first aid packs these days will have just that saline solution we could use to rinse out the wound. For burns less than 20% of the body surface, a wet dressing may be used just to cool the injury, and then dress the wound with a dry, clean dressing. Right here it says advise the patient to seek further medical attention to establish whether or not stitches or care will be necessary for this injury. So, stitches could be a possibility if they stepped on something really big. If you're ever unsure, hey, go get it checked out. Preventative, rehabilitative exercises. So we got ourselves some nice sandals here. A couple examples of sunscreen. So some of these exercises you want to do, simply always wear your shoes no matter what. Always put on sunscreen. And what does it say? Yeah, pretty simple. Just make sure you're diligent about it, and you can prevent a lot of injuries. All right, so we've reached the end here. I hope you'd enjoyed it. I do want to say I think swimming is one of the most beneficial sports and safe, mostly for a young athlete to start that athletic foundation. They can build muscle, build character, get that goal-oriented mindset, and of course stay safe, avoid those concussions, avoid those cervical spine injuries, and just have fun at the end of the day. So thanks for watching. I hope this was helpful. Again, check out the exercise videos I've attached to the links, and feel free to look through the PowerPoint. Thanks again. Have a good night.